And we're very happy to have Malin Jordal here from Uppsala University. She will tell us a bit more about herself in a minute. And she will give a presentation today about Sri Lanka, and as it was here on the whiteboard, sexual and reproductive health and rights implications for unmarried migrant workers, single mothers and women in prostitution in Sri Lanka. And we look very much forward to hearing more about this. So I give the word and a warm hand to Malin.
Okay, I'll just say a few words about myself before I start my presentation. I am a nurse with background, and I came to Uppsala because I was interested in doing something with the international perspective in a health-related field. So I started in 2004 to do my master's in international health at this institute called International Maternal and Child Health under the Department of Women's and Children's Health. So then, since I started in 2004, I have now worked in Sri Lanka for about 10 years. And what I will present to you today is actually my PhD thesis, which I defended in May this last year in 2014. Okay, so this project was realized thanks to a collaboration between Uppsala University and University of Sri Lanka in Colombo in Sri Lanka. So the theme, the gendered ideal of respectability, was a theme that went throughout the thesis, where I focused on migrant workers, women migrant workers, single mothers, and women in prostitution. And I also discussed the sexual and reproductive health and rights implications for these women. So, Sri Lanka is located in the Indian Ocean and has more than 20 million inhabitants of different ethnic groups and religions. And Sinhala Buddhists constitute about 75% of the population. Sri Lanka is focused on free education and health care for all, resulting in almost universal literacy rates in the country. And in that more than 50% of university students today are women. However, only 5% women hold managerial positions still. Maternal health indicators are very impressive in Sri Lanka, especially if you compare it to the other South Asian neighboring countries. An example is the maternal mortality ratio, which is number of deaths per 100,000 live births, which in 2011 that was 35 in Sri Lanka, compared to 200 in India and 240 in Bangladesh. However, Sri Lanka does not have a social support or social care. And also the country is very much affected by repeated violent conflicts over the past 30 years. The basis for the economy is remittances from migrants in the Middle East and from exports of tea and garments. All sectors in which women are the main contributors. The garments are mostly produced in so-called free trade zone, urban factory areas, where the majority of the workforce are unmarried, rural women who work hard for low pay, and they live in often poorly built boarding houses outside the zone. So, patriarchal gender structures remain strong in Sri Lanka despite women's education, high presence in the workforce, and also economic importance for their families and for the nation. So ideally, women should marry, have children within marriage, and be homemakers, while men should earn money and protect and take care of their families. Unmarried women are seen to live under family surveillance and to demonstrate chastity, submissiveness, and virginity at marriage. And this is important for their social acceptance and for remaining marriageable. So traditionally, marriages are arranged by the families, but there's an increasing trend of what is called love marriages, where the partners choose their own partners. So, in unmarried women, premarital sex is not accepted, while in married or unmarried men, pre- and extramarital sex is not as harshly judged. And this includes also transactional sex. So, the norms of masculinity and femininity are challenged in Sri Lanka due to rapid societal changes, including urbanization, industrialization, and also increased marital age, which is today 24 years for women. It's rather high compared to neighboring countries. And also women's increased education and economic independence. So, sexual and reproductive health knowledge among unmarried is quite poor. In a study among unmarried adolescents, only 50% had basic knowledge on contraceptives. And also, premarital sex seemed to be on the rise due to societal changes again, increased migration, Western influence, and because premarital sex is often unprotected, there is a risk of sexually transmitted infections and also unwanted pregnancies. Abortion is illegal in Sri Lanka except to save the mother's life or the woman's life. However, it is estimated that around 175,000 abortions are carried out every year in clandestine abortion clinics. And also infanticide and suicide are other consequences of premarital pregnancies. Furthermore, intimate partner violence is increasingly recognized as a problem in Sri Lanka. Whether this is due to increased intimate partner violence or increased focus or acknowledgement of that it is happening is not sure. However, statistics on controversial issues such as premarital sex among unmarried are often lacking or they're unreliable. This picture illustrates a common scene in Sri Lanka where young unmarried couples try to seek out some privacy in public spaces. Rapid societal changes have increased opportunities for premarital sex and challenged gender ideals. So women transgressing norms of femininity and sexuality are seen as a concern for their morality, a moral concern, or there is a moral concern regarding their morality. And they also risk social exclusion and being marginalized. So migrant workers in the free trade zone, women facing single motherhood, and women in prostitution were identified as having increased risks, and both in being excluded, socially excluded, and facing sexual and reproductive health and rights risks. So the study was prompted by a need for exploration of these women's situation, including their social constraints and their capacity for action, as well as their sexual and reproductive health and rights risks.
Could you clarify?
Yes.
Single mothers, is it mothers who were married and are divorced, or is it mothers who were never married?
It is mothers who were never married.
Okay.
So I know it's a bit for the shortening, but it's actually unmarried women who are either pregnant or have just had a baby and not decided. So it's premarital motherhood. So the aim of this project or thesis was to gain a deeper understanding of relationships and sexuality in women at risk of social exclusion in Sri Lanka, and the risks of violations of their sexual and reproductive health and rights that they might face. The objectives were to explore how relationships and sexuality are perceived by unmarried women migrating from rural areas for work in urban free trade zones, men's perceptions of gender relations, with a focus on heterosexual romances and premarital sex in free trade zones, how unmarried women facing single motherhood handle their situation, and how women formerly engaged in prostitution position themselves in relation to the norms of respectability. I then discuss the possible sexual and reproductive health and rights implications in all the 4 studies. So, this overview shows that all the 4 studies were conducted in the Western Province, and in paper 3, also in the Northwestern Province. For paper 1 and 2, study 1 and 2, I recruited 16 unmarried women migrant factory workers and 18 men working in a free trade zone area, in and around the free trade zones. For paper 3, I recruited 28 unmarried women facing single motherhood in antenatal clinics with the help or assistance of public health midwives. And in paper 4, 15 women formerly involved in prostitution was recruited in a detention home in Sri Lanka. I used 4 semi-structured interviews for all 4 studies, and method of analysis was thematic analysis, qualitative content analysis, and discourse analysis. And I started off by using qualitative content analysis. I wrote this paper first to gain a rich description, or to provide a rich description of participants' views. And in 2 papers, paper 1 and 2, I used a more interpretative method to analyze the underlying meaning of the interview text, and to bring that up. And also in paper 3, I was interested in knowing or seeing how the women formerly engaged in prostitution constructed their selves or constructed their identity discursively. So I also employed several theoretical approaches. Social constructionism takes a critical stance to taken for granted knowledge, understands knowledge as historically and culturally contingent, and also problematize the concept or idea of a universal truth. And gender theories, especially Connell's, help to unravel the normative assumptions around manhood and womanhood, and also to highlight this as always socially constructed in relations. And Wieg's theory of social navigation was helpful to see how individuals use agency within limiting social constraints or social environments. And also the sexual and reproductive health concept was useful to bring up the health and human rights implications for the studied women. So the concept of sexual and reproductive health and rights was coined for the first time in Cairo in 1994, and it was a change from seeing reproduction as a population control issue to a human rights issue, especially for women. So the agenda of human rights or rights in relation to sexuality and reproduction was brought up. However, it is was then and still is a contested concept, as member states do not always agree on what should be considered a right. And I have brought up some areas which could be agreed or disagreed on, but that is the rights to sexuality, education and information, respect for bodily integrity, the right to choose their own partner, to decide whether to be sexually active or not, and the access to safe, effective, affordable, acceptable methods of family planning and appropriate healthcare services, and the right to pursue a safe and satisfying sex life, all these free of coercion, discrimination and violence. So this cross-cultural study involved working with Sri Lankan research assistants. They were trained in, and they were also supervised in data collection, interpretation of data, and data handling, including transcription and translation, and also in acting as interpreters in some of the studies. So we took several measures to enhance the study's trustworthiness. This included regular discussions within the cross-cultural team. It included prolonged field visits, and it also included choosing participants with different experience of the phenomenon of interest, of different age, marital status, and background. And it also meant using illustrative quotes in the reports to demonstrate our findings. So, studying issues related to sexuality is sensitive, and also studying women at risk of social exclusion involves some ethical considerations. So to address these, we try to ensure that we undertook informed consent. We made sure that the interview situation was in a private setting, and also their confidentiality was enhanced by using fictive names in the reports. And we had also ethical approval from the University of Sri Lanka's ethical committee. So, I will now go through the findings in all 4 papers, but I will start with paper 1. study one. Better life or ruined reputation. So the women had migrated to the free trade zone to earn money and to get a better life. The factory work was hard, but they also enjoyed the freedom from family surveillance that they had in the free trade zone. However, this freedom from family surveillance also posed a threat to their reputation as respectable daughters. Ambiguous knowledge. There was a lot to learn, and they were exposed to new kind of knowledge in the free trade zone. And they found this empowering. However, when it came to knowledge on sexuality, reproduction, this was perceived ambiguous, as displaying or demonstrating too much knowledge could imply sexual activity. Morally upright friends. A positive part of being in the free trade zone was to meet other girls from different parts of the countries in the same situation, which was described as something that enhanced their self-confidence and happiness. However, to keep up an image of respectability, they had to avoid being associated with women regarded as immoral, or as having a behavior that did not comply with what was seen as respectable behavior. It means that they could, if they associated with these girls, it could taint their own reputation, and that was risky. Finding a reliable man. All the unmarried women we interviewed wanted to marry, and many hoped to find their husband in the free trade zone. But at the same time, they were aware of the bad reputation of men in the area who was said to try to trick women, unmarried, naive young women, into sex by the promise of marriage. Finding a reliable man was seen as essential for a good future. Avoiding premarital sex. So, while having a boyfriend was seen as something natural and good, having premarital sex was not approved of. It was therefore important to control any sexual urges within intimate relationships, in the case that if the man ditched them afterwards, they would be in a very vulnerable situation. Non-premarital sex would imply disrespectability and could mean social exclusion. The importance of hiding evidence of premarital sex was exemplified by notions on infanticide and suicide. Diana is unmarried and works in the free trade zone. She talks of the desperation of women who are pregnant and not married. I'll read it. Recently nearby, there's a small shopping area. Someone had left a baby in a bag. They had discovered it in the morning when the crows were picking at it. I think she may have done it because she was unable to raise the child, or because she could not face anybody, or she may have been unable to identify the father of the child. Otherwise, a child is not a burden to a mother, no? When such a thing happens, you can't raise the child alone. That person is rejected. So her quote illustrates her understanding of women resorting to infanticide. In paper 2, two masculinity constructions, the disrespectful womanizer and the respectful partner, were portrayed. The first involved sexually exploiting women, and that was not approved of. Instead, the respectful partner was seen as the morally upright. And this respectful partner was in contrast to the disrespectful womanizer, a man who cared for her girlfriend, his girlfriend or wife. The men saw migrant women to undergo a moral degradation with time in the free trade zone. So these women, who had been in the free trade zone for a long time, were seen to deceive and ill-treat vulnerable men. And also the men desired to marry a virgin, but some thought that this was not essential. However, only if the woman was honest about her non-virgin status from the beginning of the relationship. So the traditional ideals and the modern realities conflicted in the free trade zone. And pre- and extramarital sex was seen to be common, but not approved of. This was thought to hamper the use of contraceptives in premarital relations. Some believe that sexually active women would naturally take responsibility for contraceptives since they were engaging in sex, but others thought that this could be difficult and that since they had to live up to this ideal of respectability, and it would be risky for them to display to others that they were sexually active. So, this came up in the interview with Viktlana, a man in the free trade zone. Say that there are couples who have sex before marriage. Do they use birth control? Do you know of such? As I said earlier, it depends on each situation. Meaning it depends on their mindset. If the girl trusts the boy a lot, considering the feelings of both the boy and the girl, it will depend on if they decide at the time to use such. According to their needs, it will happen. I think they may not use it. This quote illustrates some barriers to using contraceptives in premarital sexual relations. So, women facing single motherhood, unmarried women facing single motherhood, tactically navigated a social environment characterized by norms of virginity, strong family dependence for unmarried women, limited work market, and different sources of informal support. So they did this by demonstrating awareness and responsibility for having transgressed norms of virginity in relation to their families, their employers, or neighbors. So tactics involved hiding the pregnancy and give up the child for adoption, or keeping the child but trying to make the father of the child responsible, accept paternity. So to ensure their social and financial survival, they had to portray themselves as respectable. This quote by Niroshi demonstrates how she planned to make the child's father accept paternity. I will raise the baby if he accepts that the baby is his. If he doesn't, I will definitely make him. Really, I don't want anything from him. I can raise the child on my own. I don't even want 5 cents from him. But I can't bring a child who doesn't have a father into the world. The quotes indicate that the father's acceptance of the child could somehow put her in a position where she remains some kind of respectability. And also then possible to keep her child. So, the women formerly involved in prostitution constructed themselves as respectable in opposition to the marginalization and stigmatization that they faced in the society. They did this by drawing on available discursive resources, or what is called interpretative repertoires. And 3 of these were in line with the cultural ideals of respectability, while the 4th was not. So victimhood, as in women as victims of men, was the most prevalent, and also involved portraying themselves as innocent victims who had been deceived by ill-meaning men, or been victims to unfortunate situations. And this helped removing some of the blame involved in being in prostitution. So resistance involved distancing or describing how they resisted being raped or forced into prostitution, but they also described resistance towards what they saw as disrespectable sex. And the responsibility repertoire, here they portrayed themselves as responsible women who took care of others and also their children. But also here they described how they took care of their own health by going to clinics for sexual transmitted diseases uptake and also for using condoms. And the independence repertoire differed from the others as it was not within what is the cultural ideal of respectable womanhood. And here they portray themselves as empowered, wise, desiring, and even dishonest persons. So Shuba describes how she, despite being involved in prostitution, resisted being accepting what she saw as disrespectable sex. I haven't been there with them the way they want, even if they paid me. Though I don't do those things, the others tell me what they're doing. I haven't allowed them to do unnecessary things. Clients, she means. The ones who are there used drugs for a long time. They're like men. I stay away from them. I didn't even take the food that they gave me. So in a way, she's talking about the other women in prostitution who she regards as disrespectable. They're like men. They take drugs and they accept all kind of sex requests from clients. And in doing so, she portrays herself as respectable. So, in conclusion, this studies women navigate and negotiate relationships and sexuality within oppressive, gendered social forces and strive to construct themselves as respectable. In doing so, they face serious sexual and reproductive health and rights risks and violations, including knowledge barriers, rape and violence, hindered access to abortion services, stigmatized motherhood, adoption, and infanticide, and also suicide. And also, in my study I focused on respectability and sexual and reproductive health risks, but here I have also included societal efforts that seem to be corresponding in a positive, negative way. I'll try to explain it to you. I have the respectability. The married woman is the respectable woman. It's the norm. It's how it should be. And she faced normal motherhood, safe motherhood issues. And this is pretty good, as I mentioned before, in Sri Lanka. And all the ordinary maternal and child health system takes care of that. So she has risks, but quite low risks, and if she fits into this category. The free trade zone migrant workers are not, they are in a vulnerable position. They are regarded as disrespectable in the fact that they have migrated. They're assumed to maybe behaving as they should not behave. And they also face increased opportunities to premarital sex, thus are an increased risks for sexual and reproductive health, ill health. So unsafe sex and abortions are what they face. And there are some reproductive health education programs in the free trade zone that try to target these women, but these are inconsistent. The quality is not really very good, and as how I understood and heard even from informants, that they don't get so much out of these programs. But there are existing programs to try to deal with the increased risks that they face. Single mothers are already pregnant. She has had ill health in a way, but she's stigmatized, so she can't live a decent life free of discrimination. So she's prone to be forced adoption, or even infanticide and suicide. And I don't know if you know that suicide and self-harm is very high in Sri Lanka, among women also. And in women of the reproductive age, it's very high. And some of my informants also talked about thinking of suicide or trying to commit suicide. And here, it's only the ordinary maternal child health system that's supposed to take care of, but they're very different. They have very different needs than married women, so it doesn't capture them. They can't even go there. Just don't dare to. And then the women in prostitution, in the respectability pyramid, she's at the bottom, as in most contexts. She faces extreme sexual and reproductive health and rights risks. All of these, but even higher for sexually transmitted infections and higher on rape and violence. She's raped on a daily basis, actually. Oh. And also, there are some urban sexually transmitted infection clinics in Colombo where they can go, but it's not very widespread. Open. So this was an attempt to conceptualize my findings in relation to this, which I thought was a little bit interesting. So, for me, this picture illustrates the ideal of respectability. And I have to tell you that this is one of my research assistants who became a really good friend, and he allowed me to use his marriage picture on my thesis. And it's beautiful. Thank you very much.
Thank you very much, Malin. I hope and think that your presentation has made us think about many things. Does anyone have some questions? Now it's open floor for questions and to discuss. Yes, please.
Your study seemed to suggest that that there, a structural. This is a structural problem. You're talking about the gender, the patriarchal society, the structural reasons. But when you ask social workers in Sri Lanka and medical doctors working with reproductive health, they always have an individual explanation, Yeah. It seems like they are unwilling to look at it as a structural problem. They always say, oh that girl, she committed suicide because this happened, this man. So, why is that, you think?
Well, I think it's... there's many reasons. I think when you come from the outside, you always look at things from a distance, and it's easier to criticize that kind of, you look more for structures than the individual explanations. Also if you apply also a gender perspective, or look at this patriarchal structures, you can see the more broad patterns in the society. Why they explain it like that? I think it's also a way of removing the responsibility for these things happening. It's blaming the individual that this is a kind of a girl she's not good, that's why she's doing that, it's something wrong with her, and that is common. I mean, even raped women, there's something wrong with them, otherwise it wouldn't. It's not even, I've heard these kind of discussions that, yeah, if there wasn't something suspicious with this girl, she wouldn't be raped. So it's a way of removing the blame from, I don't know, structures, men, society, to deal with these things and to blame the individual. And then that way you keep this kind of imbalance, and the women who suffers from these things are kept in place, and she has to just, she can't speak up. It's her who gets the...
But why do you think that the professions that actually work with these women, and why do you think they adapt? I mean, that they reflect
like that?
Yeah.
I think it's culturally inherent. I mean, it's difficult. It's something that you're so used to thinking. So it's, even if you're a doctor or good education, you don't see it like that. I'm sure it's the same thing in all cultures, but it's different things. But I agree that it's sometimes, wow, how can you say that? You're informed and you know, but it's not so strange maybe when you're brought up with that, and that's kind of the cultural assumption. It's I don't have a better answer for that.
Maybe I can help with that because I come from like this kind of culture. Usually, people who become the social worker is someone who used to be the victim. They were in the position of discriminated, but people like, let's say they are informed, they are educated, even though they never be in the same position, like let's say like the sex worker, they will still have that kind of idea to stigmatize that kind of girl, even though they are very high educated. So like most of them that I know that they work in this kind of area, they used to have the experience to be discriminated.
I just thought of something when it's talked, and I don't know if it's in the line with what you're saying. But it's some kind of, I can't see that when you're a doctor or male that you really need to distance yourself from this marginalized people. But if you take a stance, if you morally distance yourself, for example, from the woman in the prostitution, you're not so in risk of being discriminated or stigmatized as her. I think it's difficult to be a feminist woman in Sri Lanka because it's a lot of blaming, and even in the feminist writing, and it's a lot of blaming on those, even the feminist women, that you're probably sleeping around, or it's a risk in this kind of where you get labeled very easily. But that I can't see how it counts for men, but then there's other reasons for men maybe wanting to. But some of the men that I talked to, they were pretty relaxed with this sexuality. It's not such a big deal. But the women were very, very harsh. It's risky for them to have any kind of, positive values or opinions regarding that, because then they could themselves be blamed, as being one of them. So this, and even for women in academia, it's risky. I mean, I can see it in the feminist writing. So I guess it's to just protect yourself, because if you're out there being labeled, it's kind of tough for your,
What actually struck me listening to your presentation was that a lot of your conclusions and also your focuses, they're equally relevant here for Sweden, or almost every other country in the world, I would say.
Yeah.
I just find
I think so too.
That it's so obvious. That the patriarchal structures are.
Yeah. Yeah, I guess it is when you're into that, and then But in Sri Lanka, all kind of health and reproductive like messages, it's about knowledge. They think that, but they don't know, so therefore they have, they don't know that they can become pregnant, so they have unprotected sex. But it's not really about that. It's about all this kind of thing. You cannot move much. You cannot say that you have the knowledge. You cannot demand that knowledge. You cannot display that knowledge. You cannot access contraceptives. It's so risky. So in the free trade zone, in the society, it's like they're stupid girls, They don't know. They're just stupid, innocent girls. But actually, they have a quite good knowledge. More than the men, I think. Yes?
I thought it was very interesting to hear your findings, and although very sad, I have been working with this since the old family planning days. And one thing struck me in what you said, which was a little bit more optimistic, and that was that if a man accepts fatherhood of a child, then that would give respectability. Do you know any more about it? Is it a court acceptance, or how do you give legitimacy to that child?
I find that area a little bit blurry and difficult to understand, to be honest, because on one level, unmarried motherhood does not exist. That's the saying. And then when you start to look, there is kind of things. It does exist, but it's somehow hidden. And with this example, it's just, she will probably be stigmatized to some extent. But also, it's possible, and that I would like to look further into. How is it for those who actually go against the grain, say, okay, I'm a single mother, the father, whether it was helpful for her that he accepted paternity, but in some cases he didn't do that, and maybe she did it anyway, but we don't know after 1, 2, 3 years
what happens to the child.
Yeah, because the saying is that the child will be very marginalized, be stamped as a bastard, and but we don't really know if this is just kind of accepted anyway, or you kind of get around it.
Okay.
But for her it was important that it was at least not just her making up some kind of father.
No.
It was one man who said that, yes, this is it's made a difference for her. Because I think it's also easy being labeled as a prostitute, that you have many men, and if you can't tell who the father is, that's more stigmatizing. But if you have one man. But in reality, I don't know exactly how it looks.
I would like to know a bit more about why the suicide rates are so high in Sri Lanka. What kind of factors would you identify as important?
I think a lot of people, or researchers, have tried to look at that. Maybe not a lot, but some. Well, one factor, which is a bit simple, I don't know if it's a simple factor, but it's the access to pesticides in agricultural societies. But I think it's a very simplistic factor, but they have tried to have projects and just trying to reduce the access to pesticides, and it has affected the self-harm rates. It is something that seems like it's, one explanation is that it's difficult to speak up to authorities, to express your discontent with the situation. And so they talk about that this self-harm or suicide can sometimes end in death and sometimes not. It's a way of expressing anger, discontent, or kind of saying something. So they talk in Sri Lanka about communication suicide. So it's often performed in the presence of others are very close, so that it's easy to find out. It's not like going somewhere far. It's more this kind of look out, drinking pesticides in front of others. So it's a way of expressing something which can maybe not be expressed in words. And in women, maybe it's even more. It's so constrained that you can't say things. So it can be to express unjust treatment. And also to take revenge has been explained in the literature. Just if I do that, I put the blame out on you. Now you made me do that, so now you have to bear that responsibility. It's a way of throwing away the power or kind of responsibility. Maybe it's very complicated. But there's some explanations in the literature, but it's still hard to understand why it's so kind of accepted in the society to do these things.
But I'm thinking also specifically for
women?
The groups that you have been looking at, for women and pregnant women. And
yeah, for avoiding also shame and, I wanted to look into that, but I don't know how easy it is. This respectability, I read one place that if a girl who tried to suicide after accusations or after having had premarital sex, because she was blamed for it, but he was not, so she wanted to show that it was both of us, it was not only. But yeah, there's a risk because for these women, and in relation to sexuality, because this sexual disrespectability prompts self-harm behavior. Like this, my opponent for my thesis was Jean Marchek. She writes about suicides in Sri Lanka, and she says that that the women who are accused of this sexual respectability may then resort to self-harm. Doesn't even have to be a real pregnancy. It's just she feels unjustly treated. She doesn't want to live in that shame. Yes?
How sexuality differs in Sri Lanka from city to village, from ruling class to poor class, from society to society, because there is Muslim, there is Buddhist, there is Hindus. How does this varies?
Well,
and second question is, did you do all of your works in Sri Lanka, like library works, and did you use some texts from Sri Lanka? How did you manage, because the language is
okay. I'll take your last question first.
Okay.
Well, I did not read any Sri Lankan. I can't read that. And also, I used an interpreter when I interviewed in Sinhala. I could only access English literature, which in this, when it's done, research, even if it's locally produced, it's written in English. But there are written in Sinhala also, but that I could not access. And I also visited research centers in Sri Lanka to get access of information maybe that was not distributed on the net. Otherwise it was in internet and international accessible journals. Varies sexuality. Okay, this is not something I could say on behalf of my studies, but it's between the ethnic groups and religions. I'm not sure. I cannot. The majority of there were some Tamils in the sample, but majority of Sinhala Buddhists. I think they all have a little bit similar norms of this womanhood, but maybe some varieties. But it's at least, I think it's not easier within the Tamil population. Maybe even, no, I think it's similar. But when it comes to class, It's not approved of with premarital sex in women and upper classes also, but perhaps it could be a little bit more, I don't know.
Like when we talk about free sex countries, for example, wealthy European countries or America or Australia, all wealthy countries, we know in our country, for example, Bangladesh, we know them free sex countries. Free sex, the concept of free sex, majority of people from Bangladesh who never visited or not so much educated, they would think free sex means that you can have sex and it's like free.
Mm-hmm.
But when I came to Europe and I understood what is free sex means,
Yeah.
it means that you can have your own girlfriend or you can live together, nobody will ask you or whatever. That's the concept of free sex. But in our countries, we cannot imagine such happening. I thought, why Sri Lanka? Because Sri Lanka is not a Muslim country. And is it religious or is it social or is it from poverty or is it from administrative reasons? That's what.
Yeah, it's probably quite complex and it's probably not religion, but I'm not too into the Buddhist thinking, but what's partly explained in the literature is the influence actually of the colonizers, British colonizers. I guess there were regulations even before that, so it must come from other places as well. But the anti-colonial resistance involved actually taking aspects from the Buddhist culture, but also from the Victorian British culture, Christian, and this is in the literature explained as part of the reasons for the tightening of the codes of conduct, especially for women. But of course, these things are so complex that it's impossible to say that it has one reason only. But also, I'm not sure in cohabiting. Maybe it's more common than even in Sri Lanka, in maybe rural areas, than we can assume. It's said that it doesn't happen, that you have to be married to live together, but maybe it's happening, but it's kind of happening in a way, and it's difficult to get. Yeah, it's kind of that. I think there's a lot more there, and it's hard to study because it takes time and to find out what's going on deeper down in the society.
Do you have a feeling that the times are changing? I'm thinking of that the level of education and economic independence among women. Does it have any influence, or is it sounds sadly the same?
It's such a difficult. I've been thinking a lot about that, and if with the free trade zone migration and kind of increased acceptance of premarital sex, if that's kind of a pioneer group that, but it seems that maybe they're just stigmatized and even marginalized more as. So it's a bit difficult to see that they are in the forefront of the, since they're also lower social class and poor rural. So they're not. It's not the elite, but perhaps. It's very difficult. I'm not sure, and it could be the reverse, that it's tightening this cultural conducts of how it should be, or
because empowerment is an essential element in the SRHR concept. But this is empowerment without
the empowerment in the sexual area, and I think I tried to bring that up in one of the articles, that they are empowered, they have access to money, education, but they are symbolically isolated as bad girls, morally not good. So on that area, either it's just slower to change in the symbolic aspect and it comes, we don't know. It's a tricky one.
Why did you go Sri Lanka for your research? Why didn't you go Bangladesh?
Everybody's there.
Yeah, there's a lot of research in Bangladesh. Actually, it is a bit of a... But there was some interesting work from Bangladesh and Nepal in this area. I think because you have the similar migration factory zones and stuff. No, it was actually when I started a master's in Uppsala, there was an ongoing collaboration between, it was SIDA SAREC funded, as I mentioned in the beginning, between Sri Lanka University Community Medicine and then the Uppsala University, my institution there. So I was kind of just jumping onto that. But I've been, it's been very, very interesting. Been happy for it. But perhaps Bangladesh also would be as interesting.
One thing about Sri Lanka, which I think is interesting, I don't know you remember, there was a big global study called Voices of the Poor around the turn of the millennium. And they looked at various aspects of how poor people viewed their lives. And I was involved in a summary of the health aspects of that study. And what came out quite clearly was that poor people all over the world found health services abusive and rotten, and not for them, except for Sri Lanka. Sri Lanka was the one exception where the health services came out favorably also for poor people. That was very interesting, and I've been trying to find out why. Why is that so? And if you can give me a clue, I'm collecting them.
Well, maybe I'm now just reflecting. I don't know about the other countries, so it's difficult then. But it's so broad, the health care for all idea in Sri Lanka. It was, at least, some years ago, with the socialistic idea, to access all. But I don't know if that's a difference from the other South Asian countries. And also, I think, well, I also talked to my informants, some of the groups that I studied, about access to healthcare and how they were treated. And that seemed also that they were mostly positive. It was not little on the negative, like how they spoke about the healthcare system. But it's can be this kind of respect for authorities, receiving help, being taken care of. They talked about the healthcare personnel as my mother, or it's this kind of gratitude for this. I am not sure if that's a bit inherent in the culture, and I can't see how it should be different from the neighboring South Asian countries, because you could assume that there were similar ways there, but or that it has succeeded in being non-discriminatory. But I can see a lot of discrimination in the health, that you don't approve of women who transgress norms. So it's, but then the reaction from the woman is not to become angry or mad. It's like this, oh yes, it's my fault, I did wrong, I did something wrong, I'll behave now, I'll improve. It's me who's something. I'm not sure. It's a difficult.
But the woman as a victim of rape, or like their society know that they become mother outside wedlock. What happened with them? Are they also economically excluded? Like it's hard for them to find money because they are a single mother outside marriage.
What I saw is that it becomes more difficult because you have some you're not so mobile. If you don't have support, some people left their child with their mother or family, and then they could migrate to work. But it's hard for women, poor women, to find paid work, and of course also it's very low paid what they have access to. So it's this informal sector where you sell some coconuts on the street that you could do maybe almost everywhere, but you need some kind of resources. You could migrate to the free trade zone, but how can you bring your child I think it's possible, but it's a bit tricky. Then you also risk this discrimination. And the discrimination I see as fear in other women to accept this, because then they can be associated with this. And also they could migrate to the Middle East, but that's, you need someone to take care of your child. And also, so for a long time, you have to kind of leave your child behind. So the opportunities on the labor market in Sri Lanka for women, poor women, it's not so much to choose from. So it does affect them because they have even more limited possibilities if you want to choose. But the discrimination, yeah, perhaps. And that I didn't study. What happens afterwards when they choose to keep their child? How discriminated are they? Because I could see in my work that it was like, yeah, they talk now and then later they stop talking. So maybe it gets normalized into the, but also you're probably a bit stamped as a woman when you have your own child because you remain unmarried. And that's also economic insecurity not to have a provider. So I didn't study it systematically, but there's some anecdotes in my work.
Thank you so much, Malin, and thank you all for coming.
Yes.